We have heard the creation of a new profession, and it's called experts in ACO, when we don't know what ACO is going to look like. So be careful, because I suspect many of you at your institutions have already been approached by, quote, ACO experts. And it's an interesting concept when we don't know half of the rules. We have more questions than answers. But where does the RPA stand? And to do that, I think you have to go to what the centered medical home or medical neighborhood, a concept they brought up about principal care physicians, and it's more dedicated to specialists. And essentially says specialists who address the majority, not all, the majority of the needs of patients with chronic conditions. So you start falling into, well, sounds like this is nephrology. And we've been doing this for a long time. We just didn't call it ACO, but we've been doing this for a long time. So in answering this, the RPA did a quick and what I call dirty survey of about 900 practicing nephrologists this year. And we asked some key questions. Number one, 45% of the nephrologists that answered say they provide over 50% of the primary care services to their patients. It's almost 50% if you think about it. 82% stated that 50% of their patients had a primary care physician. Personally, I thought that this is more than I expected, but that's what the survey said. Now, of those that had primary care physicians, 74% of the nephrologists responding co-manage the non-ESRD care with their primary care physician. Big numbers. So we asked the main question then. Do you want to become principal care physicians? Do you want to? And the answer was 75% of the nephrologists responding said if adequately reimbursed, they would provide the services. So this is data that from a recent survey that the RPA did. So we've heard some common words with the previous speakers. We heard collaboration, we heard quality, we heard cost, care, and coordination. And this is what we're talking about in different ways. Nephrologists, what have we done forever? You know it better than I do. You know, we've done all of this. You know, we're the best trained to take care of the problems with the ESRD patient. You have some primary care physicians that feel that ESRD is like leprosy. I don't want to deal with them, you take them over. And you have other ones that want to be involved in the care of their patient. We coordinate ESRD. We are leaders, or should be leaders, in the care, and especially in the care team and interdisciplinary team. And if we're not, that's a big mistake. We should be the leaders there. We direct, or should be directing quality as much as we should be directing assessment of the quality. And like you have heard, you know, there's a broad-based community support, stakeholders, about this concept of a renal-related ACO. So, what should be, in broad sense, the nephrologist's role in the renal ACO? Serve as the principal care physician, coordinate care, especially if there's PCPs involved. Definitely provide, preventive care or help provide preventive care. Monitor of care outcomes is going to be required. Cost, oversee the quality measures that soon we'll know that they have not been set yet. Like Frank said, we're still pending to see what the government and the secretary is going to say. So the RPA recommendations at this point is RPA supports a nephrology-centered ACO, Safeguards should be in place to ensure nephrologists' autonomy with the SRD ACO model. But remember, this is collaboration. Nephrologists involved in developing the business models. We're not going to spend time because we don't know what the business model will look like. So at this point, nephrologists must be allowed to serve as the principal care physician. Education of nephrologists is key for this to occur. Now, as you well know, this may come in different flavors. You may have an ACO that is a hospital-based ACO, and you as a nephrologist may have a different way of looking at this. You may have a renal-related ACO. So you have to adapt. You have to adapt locally, you have to adapt where you are, you have to adapt by the pressures we have. So we have, like we said, a lot more questions than we have answers, but it's fun to try to get the answers together. Thank you.